name's Joanne and I'm a veterinary nurse. I'm the head nurse at a small animal practice in London. A typical day for me would be to come in, check all the inpatients, the ones that are staying overnight, make sure they're all happy and clean and give them all their medication and food. We obviously have all the day patients coming in who are coming in for surgery. We would weigh them, give them some drugs to make them go to sleep for their anaesthetic and get them all ready for any pre-procedures they need. We then assist with all the surgery, so we're in theatre, getting them all ready, watching their anaesthetics and then monitoring their recovery. The afternoon we generally spend with our trainee nurses. We help them through all their portfolio and all their studying and give them any practical help they need. We would also keep obviously the animals all happy in the afternoon, keep them all clean and update the clients as to how they're doing from their surgery. We get lots of challenging cases. We are able to clean up all their wounds, maintain dressings, place them on fluids, so we get a lot of involvement and a lot of hands-on training. And we're able to sort of carry out a really good varied role every day. We've got a range of staff at the moment, so we've got another qualified nurse. She's qualified last year, so she's sort of now relaxed after studying. We've got someone who's completing their second year this year and who's been with us for several years, and someone who's completing their first year. We've also just taken on a completely new person, so she's had a range of skills before she came to us, and she's going to start college in September. We also have another nurse who just helps us out. She's not qualifying or going through that route, but she's here to help us out and do any little routine jobs that we needed to do during the day. Okay, personally the way I got into the role was I used to volunteer at a local charity on my weekends and go and help them clean out all the animals and keep them all, got lots of practical experience. I then got a Saturday job while I was doing my A-levels to help the veterinary nurses that were here and really found that was the job I wanted. I secured a training practice at the same practice and went through all my training both years and then went through to do the assessor's qualification so I could train other nurses, and then a couple of years ago got my deputy head nurse and now I'm the head nurse of 6 nurses.
Okay. And Jo, what's the most important skill or attribute to have to be successful and fulfilled, I guess, in this role?
Okay, you have to have a lot of passion for the job you're doing, be a really flexible team player, be hardworking, and be willing to adapt your skills as and when certain patients come in. We obviously have emergencies coming in, and you really have to prioritise what cases you're dealing with and deal with the first aid ones first. So to be flexible whilst remaining calm and not letting the stress get to you is really okay. I like that it's a really varied role, and you never know what's going to come in each day. You get a lot of hands-on practical work, and it's very varied. The hours can be long, and you sometimes are required to stay after, which sometimes it can be a bit stressful, and you have to do weekend work and bank holiday work. But that's really the main disadvantage of the job, really. And also a lot of people don't always know about the role that veterinary nurses do, because a lot of times we're behind the scenes, so people don't always think of us as sort of a real integral part of the nursing care.